My name is Dr. Elizabeth Ann Comen, and I am a breast oncologist at Memorial Sloan Kettering Cancer Center. The most common risk factor for breast cancer is getting older and being a woman, because breast cancer becomes increasingly more common as women age. Another important risk factor to know about is family history. Some people think that breast cancer is only inherited through genes on the mom's side, but it can also be related to genetic mutations that could be found on the father's side. Having had a prior biopsy for an area which indicates some abnormality, not cancer necessarily, but for example, atypical ductal hyperplasia, which means that some of the ducts in a breast may have grown abnormally. There are different markers that if a woman has had a biopsy, it's important that she talk to her doctor about whether those markers are lending themselves to an increased risk of breast cancer. Having had radiation, some people may have had radiation for a childhood diagnosis of a cancer to their chest, such as for Hodgkin's disease. Those women may have an increased risk of breast cancer. Other areas are also of concern. It's important to think about lifetime exposure to estrogen. About 2/3 of breast cancer are driven by the hormone estrogen. So that means if a woman has had her period at an early age and started to go through puberty at an early age, at 7, 8, 9, and potentially a later age of menopause, it means that her lifetime of having had menstrual periods and being exposed to higher levels of estrogen is higher, and therefore her risk of breast cancer is slightly higher. Not having a child before the age of 30, as well as not having any children at all. Taking hormone replacement therapy can lead to an increased risk of breast cancer. And then there are also some lifestyle factors to think about that are more modifiable, such as being obese, drinking, and other lifestyle modifications, including, while there's more research to be done in this area, it looks like if a woman is not exercising, she may also increase her risk for breast cancer.